Chin and jaw implants are a really important aspect of facial aesthetic surgery and harmony when it comes to enhancing the jawbone structure. Of course, for patients who have concerns about having a smaller appearing jaw, a weak looking jaw, no degree of soft tissue lifting or fat grafting or filling is ever going to correct a smaller jawbone. And oftentimes a small jawbone can manifest in several aesthetic ways. Number one, it can make the face look smaller. The lower facial frame looks smaller, which looks less masculine. So for men who have a small lower jawbone, lower face, enhancing the jawbone structure can really make a big impact in terms of the way they present themselves as a more masculine appearing, more robust face. Number two, the neck oftentimes is very loose and lax and bulges outwards, because if the jawbone is small, then the tissue contents that live inside the jawbone just bulge outwards, particularly with head position downwards. If we look at the jawbone structure, it's actually a hollow ring structure. Tissue lives inside of the jawbone, and when the jawbone is small, it just can't contain the tissue that lives there. So enhancing the structure of the jawbone can actually contain the tissues much better, and we don't have a heavy looking, blunt appearing neck contour. So how do we enhance the jaw structure? Well, several ways. There are basically two regions that I focus on. Number one is the back of the jawbone here. This is called the gonial angle, and the ramus is the vertical portion of the back of the jaw. The other area is the front of the jaw, the chin bone, or symphysis and parasymphysis in medical terms. Let's focus first on the back of the jawbone, where the gonial angle is located in the ramus. This is an implant that I use very frequently. It's called a porous polyethylene implant. It's a biocompatible material that I can use in a very precise manner to enhance the structure of the jawbone. You can see it's a triangular structure that keys in over the gonial angle in a way that can give more width, more height to the ramus, right? And also more structure to the body of the mandible. So we're improving the structure in all dimensions of the mandible in 3 dimensions by using these implants. I place these through hidden incisions inside of the mouth, so we don't need any cuts on the outside here. I can make a hidden incision inside the mouth and place this implant very precisely to fit over the jawbone and without any visible scars. Same goes with the chin implants, where I can use an incision on the inside of the lip, right in there, okay, or I can place one under here. If I'm doing neck sculpting additionally, I'll do an incision here, but I can also do it through a scarless approach. And the implants that I like to use are these porous polyethylene implants, which similarly have a structure and design that can fit over the chin bone in a way that gives projection, gives height, gives greater degree of greater width. So all 3 dimensions, we can improve the structure of the chin bone. Now, when we combine these procedures, it can really be a powerful combination. You can see that the entire jawbone can be enhanced when we use these implants in combination. So it's all a case-by-case discussion, and these implants are proven to be safe, effective, helping patients with small jawbones. Primarily, I'll use it for men, but also for women who have an overly small mandible. I'll use these implants effectively to create better definition, sculpture, and overall balance. That's where the art of plastic surgery lies, is knowing how much and how large these implants are, should be for each face. So when we consult, we'll go into those details and just know that this is a safe and very important part of lower facial sculpting.